Let's continue. Endodontic method. Single motion technique we have completed just now. Now let us go to the double motion technique. As the name itself is telling us, required to use a winged or wingless clamp and involves a 7-step procedure over here. So like a few steps are here very common. Select the clamp to be used, punch one appropriate size hole just off center of the 6x6 piece of rubber dam material. Loosely attach the dam material to the four corners of the frame. Place the clamp over the bulk of the contour of the tooth to be isolated and ensure the clamp is secured. Stretch the dam over the clamp so that the dam material is seated under the clamp and hug the cervical area of the tooth. Completely stretch the dental dam all over the prongs of the frame. Use floss to aid in passing the dam through the contacts. So it is a picture showing that once we do like here, we can place the dam sheet first, retract, and again as a support we can place the clamp. Usually for the anteriors we use this method. Again we can see without the clamp we can manage with the wedgets or dental floss ties. So however, whatever we do the method of this thing, transferring the rubber dam sheet to the patient mouth, we have think into the mind few things like use of saliva ejector. So whatever like aerator water will be using with the 3-way syringe will remove, but at the base also will be having some saliva pooling. So we have to lift the rubber dam sheet and do the suctioning. Confirm a properly applied dam, then only you have to start the procedure, and check for the access and visibility. As we have already discussed, if you want more retraction we can use these wedgets. So now let's move to the modifications in designs. Optradam, this is the latest modification in design. It has some advantages like there is no need of any frame, it is very easy to place, and it has a self template, so much armamentarium is not required, and it is little bit more comfort to the patient. Okay, in that way it is comfortable. So this is the latest one. Instidam, it's again it doesn't in the here we had it 2 rims. In Instidam it has only 1 rim. This handy dam also it has built-in foldable radiolucent frame and the plastic tube inside in prepared holes in rubber dam material to keep the dam open. This is called as dry dam. Dry dam is a rubber dam laminated with the paper on both the sides of the attached straps. Mark the punch spot, and the slurry built in the paper frame makes it simple and fast to apply. The patient's lips, cheeks are protected by the moisture absorbing paper, reducing the risk of allergy. So this is the paper. And this is the new latest equipment which is coming into the market called as Isolite. It is not any sheet or anything. It is a silicone based material. It is convenient hand-free suction and retraction unit. So here it does the dual work. It will do the suction and again the retraction until that can be used during the dental appointments. The dual vacuum power and the silicone bites easily connected to the most of the dental high volume portion of the operatory, solving many of the frustrations that the dental professionals deal with the daily. So this is then posterior piece, and this is for the anterior piece. So advantages of this is that intraoral illumination, dual quadrant hands-free suctioning. So it has inbuilt suction. So again there is no need to add another suction or no need to have extra assistant. In that way it is little bit better. Integrated vacuum hose utilizes patented mouthpieces that the advantages of this mouthpieces is retraction, isolate, suction, illuminate, protect soft tissue and patient's airway. Now let's move to the modifications of clamp. The first one is cushioning metal clamp jaws. As we know, the clamp jaws is made up of a metal, so that may hurt the soft tissue. So that has been cushioned with the material called as ferrite N. These are the chewies. These are again made up of plastic, same cushioning type. These have been adapted to the like jaws here. So you can see the magnification view. So these are removable Okay, removable. After use you have to throw this frame can be autoclaved. So these are the other new modifications. Nowadays, if we are comfortable with the wingless and comfortable with the procedures, then if we have this 6 sets, then we are done with maximum things of our rubber dam. So these are called as Brinker's dental dam clamp. Okay, this is for the pedo size. Okay, this is for the left upper molar, and this is for the right upper molar B3, and this is the for the you can use for bicuspid like premolar or for the anterior. This is the most commonly used, and you can see everywhere. If once you start using this one, you will not stop. And this is the B5 for all bicuspids and incisors, and this is again for bicuspids and incisors B6. We have a special molar clamp with extension. These are the extensions to retract the tongue. If any patient is having a bulky tongue, then you can use this type of clamps. Extended bow clamps. As name itself is saying, the bow has been extended back. So these are indicated in situations where 7 is grossly decayed and we don't have 8, and we don't have facility to place a clamp on the 7. Then what is the situation? As we have already seen SG clamp, it's opposite of that. Okay, that has an anterior extension, this has a posterior extension. So place the clamp on the 6 and perform the treatment on the 7. These are the Haller's clamp. These are again a modification where it has a rest, hook like type of rest, where we can place our suction tip. Okay, so again these, as the name itself is saying, it has a posterior extension. Okay, so these are manufactured like it can be adapted to only premolars, that can be 4 or 5, so never it comes in the size of 6. So it's an sectional opening. If you want to perform on 6, or if you want to perform on 4, or if you want to perform on 7, then this complete quadrant has to be, section has to be opened. So it has these hooks where we can place the suction. Now let's move to the aesthetic cases. As you all know, for aesthetics, if you want to perform any bleaching and everything, we need a perfect isolation that can be achieved with the rubber dam sheet. Here we have to use the heavy type of rubber dam sheet so that we can do proper inversions. See, this is the B4 clamp, very comfortable, very easy. There's like, it is damn easy. Now let us see the video of that. So we have placed the dam first, then we are placing the clamp. So this is the way to do the inversion. Slowly tuck the margins of your hole and invert into the soft gum pockets. PDL, I am to say. Slowly. If you feel any we are not able to perform with the plastic filling instrument, we can use the floss. When you are using the floss, don't insert it down and pull it from the top. You should insert it from the top and pull it from the buccal way, so that we should not irritate the contact. So these are the floss ties. Earlier we have seen how to prepare the floss ties. Prepare like that, engage and check palatally also it is covered or not. So these floss ties will give you extra retraction, and we can see till the base. Techniques for special situations. So here are the few examples. So which we have to use, let us discuss. Multiple adjacent tooth require treatment or extreme mobility of the tooth being treated. As you all know, we have to do sectional opening. Multiple tooth means sectional opening. So here we have the one method is that place the clamp on the most posterior tooth which you are opening and most anterior tooth by reversing it. This is the one method. And another method is that normally in the anterior position, posterior you can place the clamp. In the anterior we can stop it by placing the floss, wedget or anything. So the thing which we have discussed, the posterior, the most posterior here, the posterior teeth with the distal side. Okay, again the anterior towards the mesial side. This is called as double clamp technique. I have already shown you another picture of anterior where we have used this double clamp technique. And placement also we have seen. Again here also it's a double clamp technique. So for extra retraction, you can use double clamp with floss ties. These are the floss ties, especially in the cervical class 3 areas. So when you're doing any restorative procedure on class 3 or class 4, it's obviously very clear that you have to open up to canine or first premolar to premolar, and the tooth which you are performing, you have to place the floss ties. It is must, mandatory and easy. So partially erupted tooth or teeth with a short clinical height, we have already discussed. One is that usage of an gingivally directed clamp. Gingivally directed, that is first option. Use of serrated jaws or tiger clamp, which we have already shown and discussed. And another is the self-glue resin beads. This one also we have discussed. Okay, in anteriors we'll be doing the, you can ask me that for posterior also same. Yes, definitely. For posterior also you can follow the same technique here. See, in few situations after access opening we'll be having the class 2. So all our irrigants we can't stay inside. So we have to do a build-up. That is called as pre-endo build-up. Okay, once you do this pre-endo build-up, you can have an extra thing of composite on the buccal side so that it will retain. Severely broken down tooth, we have already discussed. The solution is that modified clamp, that is SG clamp. We have discussed here as shown in this picture. And here we are looking into the new technique called as split dam technique. Indications when anterior bridges are, I'll be showing you the pictures. There it is indicated. So how to do? Make the like 2 holes 5 mm apart each and cut the septa and retract. So this technique is especially useful when badly broken down teeth or subgingival margins we have to do. So if we have a class 3 with subgingival, then split dam technique. Class 3 which is not subgingival, then a regular technique. Again, abutment tooth where we have to place the crown, bridge fixing or crown fixing, preparation of crown restoration. In these situations, we have to use split dam technique. Next, quadrant isolation. You have already seen the video of this. So a complete quadrant has been opened. In crowded teeth, as other pictures which we have seen, if it is completely buccally placed, that tooth we can't do any isolation. If this is the scenario, then how to do the things? You have to place your Rubberdam sheet on the natural tooth and point at the highest point of the tooth. One point here, one punch, one mark with the marker pen, one here, one at here, one at here, and punch it and slowly place the dam sheet first. Then you can stabilize it with the wedgets or floss. So this is the thing called as blind clamp retention or technique, where here we want to open the 4th quadrant, but our dam sheet is getting foldings. To avoid that foldings, we are placing a clamp so that there is no foldings and we have more retraction. Again, bridge, abutment or splint on in orthodontic, definitely we can place the Rubberdam. See, the orthodontic bracket is there, wire is there. Same simple procedure, nothing to get panicked. You all know 4-point contact, clamp selection, placement, everything is same. In single motion technique you can complete. Again, for the things like this, if you any class 2 are severely broken, do pre-endo build-up and place. Again, if you haven't, you have to do RC for this particular premolar and adjacent tooth is also not there. Then you have to select a, usually here we go with the B4 clamp. That's the best clamp for this type of scenario. Okay, place it, or else you can do only one bracket debonding. Usually I don't prefer even that, also place little bit gingivally and perform the procedure. Isolation of 3rd molar. In the standard clamp of the bow, interfere with the ramus of the mandible. Modified bow clamps are so designed that the bow lies on to one side. That means it is slowly the bow has been directed towards the parietal side. Okay, you can't buy this many clamps, then what you can do? Use the SS white clamp holder and rotate your clamps towards little bit towards the parrot. Then you can solve the problem. Fixed bridge isolation, that's also done. You have to perform here split dam technique as shown in this picture. So mark canine and join all the things in arch form and open in a split dam technique, and the steps are very similar. There, if 2 adjacent tooth 5 centimeters apart. If many teeth are there, Then mark this point and open. You can see this picture. For indirect restorations, which we have already discussed, in this situation also we have to do split dam technique. This is a regular technique case where we are placing an endo crown. For placement of an endo crown, we are based totally on luting cement material. So the success of that material is good when we achieve the proper isolation. So for any like ceramic or else zirconia type of materials, place your rubber dam and lute it. See, these are all ceramic, precious material. So we can't get compromised. So we have to place the rubber dam. Again, this is the before clamp, and easy for this type of cases. So this is sectional opening where we are performing the multiple restorations. At a single go, we are doing 3 restorations, 2 MODs and 1 MO, like this.